Hello, everybody, and welcome back to the Patient First podcast. I, of course, am your host, Dr. Bryan Laskin. As always, I am so happy that you're here, and I'm really excited to talk to an amazing person in dentistry, John Nadeau, who's the president of Sleep Group Solutions and Apnea, and helps dentists succeed clinically and financially by starting and growing dental sleep medicine programs and standalone DSM businesses for over 20 years. John, thank you so much for being on the podcast.
Well, Dr. Laskin, thank you very much for having me. I'm excited. Anytime I have an opportunity to talk about sleep, I'm I'm open to it. So thank you for the opportunity.
Well, and I would say the same thing, although I'm not a sleep dentist, but I've been involved in the space sort of from a product perspective before. And
Mhm.
I think it is uh one of the areas of dentistry where I think there's a lot of myths, misconceptions. Maybe people have tried to dabble in it, and you guys haven't figured out, right? So how can I guess how did you get to the point where where you personally have been involved with being so passionate about sleep dentistry?
I never on purpose, right? It's always this happy series of accidents. But I started out in this honestly as a patient, like so many practices that we work with. They come to us and say, "Well, I have apnea. How do I help myself?" And then, "Oh, my brother has it, my dad has it, and it just kind of snowballs." But I started out as in college. A friend of mine in college, his father was one of the first real sleep dentists, if that's such a thing. And I got my first sleep appliance when I was 19 years old, and I've been wearing one ever since, all kinds of different ones. And we had an opportunity, back 20 plus years ago to start spreading the word, and sleep was very different back then. Sleep was really kind of an adjunct to a lot of a lot of practices that focused on craniofacial pain and TMD, and that was sort of the focus, and sort of as a side thing, hey, if I put you in this deprogramming splint that brings you down and forward, oh, you're also going to stop snoring and your airway's going to get better. And this whole like sleep medicine thing sort of branched off from there. And we had an opportunity in 2005 to start up Sleep Group Solutions, really just as there's all these little camps, right? All these little entities in sleep, and there's appliances. There's dozens of great appliances. There's some technology. There's some software solutions and EMRs and billing and marketing and all these little components. And we took it from a Sleep Group Solutions standpoint and said, all right, if we pull all these things under one umbrella and make them all work together the right way, then that kind of becomes more of a system. And so that's what we did with SGS way back in '05, and
Well,
it's gone really well.
it's funny because you're speaking my language. Like we're all about connected dentistry and connecting disparate systems together.
Sure.
And I completely hear what you're saying as just from my experience as when I was getting involved with incorporating sleep into our practice. There's all these disparate companies and products that you're right. Until you guys came along, I don't think anybody did bring this all together. And in my perspective, from what I've seen, is that the dentists that are most successful in sleep, and this I could be totally wrong here, so I'm looking for you to either validate or or tell me, because you're much more knowledgeable than I am with this, right? That that some people can incorporate it into their general practice, but a lot of sleep dentists, like, it is its own, almost, it's either a sub entity within the practice, or else it's its own practice on its own, kind of like ortho. I feel like orthodontics you can do within a dental practice, but it's kind of more challenging than incorporating it on its own. Is that
Absolutely. No,
true or not?
absolutely. It I mean, it always starts as an adjunct, right? Almost always. It's rare to see a brick and mortar dental sleep practice just start up out of scratch. But you're right. Most of the time it starts in a practice, but it is kind of its own island. It's its own entity, and often a separate business entity within the practice, even. And there's reasons for that, and the medical billing and all that stuff, which we could touch on. But yeah, usually it starts off there. And then sometimes, and for most, it probably just stays there as a nice adjunct to the dental business. And I think a lot of providers look at it sometimes as like a transition plan. Like, I've got my core dental business. I've built it up. But I'm also interested in the sleep thing, and that's what my path might be for, my later years in practice, right? Kind of transition into sleep and breathing and airway. It's something that is rewarding financially. It's rewarding emotionally, right? You're helping people. You're truly, hitting your calling as a healthcare provider, taking care of these people, and they're profoundly impacted by it. And but it's also not very taxing, right? I don't know how many dentists you and I have run into over the years with bad necks and bad backs and bad, from, you're paid, as a dentist, you're paid for production, right? You're paid for what you do. You're paid for what you know. You're paid as a doctor, right? Your time is consultative, not physical, right? Not engaging, not taxing, because really all the work is done by your assistant, by your sleep coordinator. So I think people look at sleep as kind of an appealing path to kind of transition into, and it certainly is. You just need the solutions, right? You need to be confident in that you're going to get paid, and there's a solution there. That to me, if I had to pick one thing that people say to me, hey, why I haven't gotten involved in sleep, it's that, right? I'm unsure about how to get reimbursed. I'm unsure. I'm scared of medical insurance and Medicare. Those are scary words. I don't want to deal with that. So that I think has kept a lot of people on the side, sort of watching. Mm.
Yeah, so you hit on two massive points that I would like to kind of like discuss. Number one, the benefit to the provider for financially, and also I guess from if you don't want to like if you want to be paid for being more consultative than actual doing treatment, right? It's a nice transition for
Sure.
multiple different reasons. But there's this also piece where I kind of feel like bruxism, like which is related obviously, but but it's vastly underdiagnosed and treated in practices. So treating this like a hobby that you do once in a while is a gross disservice to your patients, right? So, yeah, if you want to talk about that a little bit, because you probably have the statistics that I don't have, but then also I'd like to talk about the barriers that dentists see, because I
Sure.
totally agree with you that there's these like probably the real barriers that dentists see about medical billing and how do I actually enter this world of sleep, that you've put together solutions to kind of like you basically have blazed the trail for somebody just to walk down, right? So could you now those are
Yes.
two totally separate things, but
Two
I don't want
separate
to forget
points, but
asking you about both of them, right?
really important stuff, right? So the first one, you talked about the fact that we as a, I'm saying in dentistry in general, are kind of doing a disservice not addressing this at the rate it should be, because and I'll say this, it's noontime where I am. I don't know where you all watching, but you know every single practice in the country out there by noontime, every day that you're open, you've had two or three sleep apnea patients walk in and out of your door. This is something that the research says upwards of 30% of your adult dental patients have a diagnosable sleep disordered breathing problem. And that's the reality. The reality is it's there, it's looking you in the face every day. It's not just the 400-pound guy that walks in with the 22-inch neck and you're afraid he's going to break your dental chair. Like it's he has it. He for sure has it. He's probably having apnea while you're doing dentistry, pretty easy. But there's a lot of other people too. And so we got to take those barriers away. We got to have those conversations. It doesn't hurt to ask about snoring. And honestly, people will pour it out to you, right? If you break that mold. I've never asked a person ever, "Do you snore?" And they just say, "Nope," and then they shut up. It never happens. They either snore or their spouse snores, their kid snores, their dad snores, and you're going to get a story about someone in their life that snores like a freight train. And that's kind of the door opening, right? Now we can have a conversation about, well, what else is going on? Do you find yourself tired, fatigued, and sleepy during the day? Are you taking any medication for high blood pressure? And we're kind of going down that path. We're not saying, do you have sleep apnea? Because they don't know, right? But they do know they have all this other stuff. And gosh, it's such an opportunity. It's sad because everybody is exposed to it. You can't not see it. So if I could have one wish, it would be that if every practice would start having those sleep health conversations and getting some patients down the path to treatment, whether you make them an appliance or treat them or not, that doesn't matter. But open the door because they're seeing you more frequently a lot of times than they're seeing their own physicians. So there's an obligation, I believe, there to really do right by them. So that was your first question.
Yeah, I totally agree, and
um,
the consequences of sleep apnea obviously are well documented, right? So, I mean, we don't have to go there, but basically can end in fatality, right? I mean, these are massive, massive consequences that left ignored. You're doing them. I agree with you completely. You're having a you're just not doing it. We're not doing our jobs as healthcare providers.
I was teaching a course in Washington D.C. a couple of months ago, and I had a dentist there who brought a friend of his who was a cardiologist, and the cardiologist just was kind of auditing the course just to learn about what we do in dentistry for sleep. And I called him out in front of the room, having never met him before or anything. I just said, "I'm going to put you on the spot. I want you to tell me a number, a percentage. How many of your patients, as a cardiologist, have sleep apnea?" You know what he said? All of
100%. Oh,
them. So he didn't say half. He's like all of them. That's ultimately it, right? This is the number one risk factor for a heart attack and stroke. I mean, it's
mm,
there's there's nothing else that could increase your clinical risk more. It's worse than smoking. It's worse than diabetes. It's worse than obesity. It's connected to a lot of those things, but it's by itself. So yeah, it's something that we should be doing, whether you are a sleep dentist or not.
yeah, totally. Well, so now could you kind of talk to the sort of barriers that the average dental practice has to overcome, or whether they're real or just imaginary, because some are like medical billing for dental practice is it's a PIA, right?
Yeah, it
And so
is.
you've got to figure out a way to do it that in the course of your busy workload. So could you talk about those barriers and kind of how you help people overcome those?
Absolutely, and there's a lot, right? There's a lot of things, and I think you put it well, where some of them are real, and some of them are sort of perceived problems that don't really creep up in real life. I've seen, one of those perceived ones is fear about causing, you know, TMJ problems or a profound bite change and things like that. And you know, on one hand, yes, teeth can move, bites can change. It's not terribly uncommon. It does happen, but we got to take everything and I always tell people, when we're teaching this, you got to sort of take your dentist hat off, right? You got to look at this like a physician, and everything in medicine comes with benefits and side effects, right? You look at every drug commercial you've ever heard, they tell you 10 seconds of why the drug will help you and 50 seconds of all the bad stuff it could potentially do to you, including dying, right? But they still sell it and it still makes billions of dollars because the benefits outweigh the risks. And so, yeah, yeah, bites could potentially change. And as a dentist, that might really bug you. But you know what? It's not going to bug your patient because they're not going to die, right? It's all relative. It's they can, you know what? They can sleep with their spouse again. They wake up and they don't feel like they just got run over by a truck. They
Mm.
couldn't care less about anything else. So it's all perspective and it's all relative. So there's things like that that come up. The big one, like you talked about, is medical billing. Just scary, right? It's out of our comfort zone, and I don't know how many times I've talked to a doctor or the admin staff, and they say, "Oh gosh, doctor told me to bill insurance. I don't have a freaking clue how to do that, and now I don't know what to do. And sometimes they'll try a case like that method, right? Spring it on your insurance person in the dental office and say, "Hey, bill United Healthcare for this." And they're like, "What? I don't know how to." And rarely does that work, and then that kind of creates a sour taste. So yeah, you need a solution. What I would say with that too, and it kind of relates to what I just said of kind of taking your dentist hat off. We started doing this a long time ago, and it was more fee for service, right? Do your service, do your thing, sell it for cash. And then it kind of transitioned more into a, well, bill insurance, work within the scope of medicine, but bill it out of network, right? Be on the side. You're safe that way, and things have really transitioned in the past few years to a more, in-network kind of model where the practices that are hitting a home run with this, the ones that are absolutely crushing it, are less concerned about the one case and they're more concerned about the 100, right? So it's volume over the big cash fee for that one you could potentially do. And I'll tell you that physicians who ultimately hold the cards here, the thing they care the most about, they don't care if you're a diplomat, they don't care what appliance you use, they don't care, they care, can you bill insurance? Is my patient going to go there and you tell them, oh, my fee is $4,000 and we take Visa, MasterCard, and Care Credit? They'll send you a patient once, and then when that patient goes and complains, you're not getting any more. The offices that can play by their rules in that medical kind of sandbox, they're the ones that win and get all the referrals. So as part of our program with Sleep Group Solutions, that's something that we take off the table for a practice. Nobody's going to go and figure out how to be credentialed and get all that stuff going. So we do it all in kind of this outside the practice solution where you focus on finding patients, building relationships, and being a good clinician. And you put the patients into the system, and really they get diagnosed, they get seen by a physician, they get the prescription for the appliance, all their benefits are checked, collections, whatever is due, deductibles and whatnot, copays are done outside of your practice, and they come out the other end of the system having been diagnosed, accepted treatment, paid for treatment, insurance is all checked and squared away, and they're ready to go for scans and records in your office. And we found that when we do it that way, it gets the buy-in of the entire team. It gets your office going quickly without having to deal with it because you do need to. Nobody's going to succeed in dental sleep without being able to bill insurance. So that's the way we've started doing it. Works really, really well, and kind of takes that barrier away.
So you take that barrier off the dental practice and you guys
Take it
have
off
it.
the,
So,
still there. I mean, you got to do it. You got to play ball. We got to
yep.
get you credentialed. We got to get you set up. It's advisable to be a Medicare provider, and that doesn't impact your dentistry in any way, shape, or form. This is just for sleep, but all those things need to get done. And if we do that, it puts you on par with the physicians in your community who ultimately hold all the cards and have all the patients. Once you exhaust your dental patients, which there's hundreds in every practice that need this. But eventually, once we get past there, if you want to grow this business, it's through referrals and being able to play the insurance game like the physicians do is what's going to earn you those. Simple as that.
Well, great. Well, you know, first of all, thank you for all you're doing because you're helping thousands and thousands or millions of patients that get treatment that they need in the way that kind of meeting them where they're at, right, and helping dentists meet them where they're at. So, where can people go to find more information to get involved to get started?
Absolutely. So if you're interested in learning more about dental sleep and what it could potentially look like in your practice, the way I typically do it is have one of our sleep coordinators come in for a consultation, just kind of a test drive, if you will. Let's help some patients. Let's screen some people. Let's do some studies. Let's show you what the experience would be from start to finish. I like that. And some offices, it's a great fit. Other offices, it's not. So it's really let's do that. That's a really good way to see what it's going to look like in your office. So if you're interested in that, sleepgroupsolutions.com is our website. You could submit your info, and we'll be in touch to to schedule something live with you and your team. See if this is something you could certainly take off with in 2024.
Great. So just go to sleepgroupsolutions.com.
That's it.
John, thanks so much for being on the podcast. It's a pleasure.
Dr. Laskin, thank you so much for having me. I really, really appreciate it.